Antibiotics can certainly be a life-saving course of treatment, but getting the right kind and the right dose can be tricky, and sometimes even doctors can get it wrong. A new study from researchers at the University of British Columbia analyzed over 125,000 patients. Some were prescribed a class of antibiotics called fluoroquinolones, and the others had taken amoxicillin or azithromycin. Those who took fluoroquinolones had double the chance of developing a leaky valve in their heart compared to those on other antibiotics. Cardiologist Dr. Joel Kahn is still with us via Skype. It's pretty alarming because the fluoroquinolones are prescribed quite often, and to hear that you have double the risk of having a leaky valve, what were your thoughts when you read this study?
Yeah, this is like really concerning, and I will actually give you guys credit for bringing this to the public attention, because this is still quiet in the medical world. 25% of all antibiotics in America fall in this class. And this study said there's an association, this is the first time this has been reported, of developing significant leaky valves shortly after a short course, 7 or 10 days, for a urinary tract infection or bronchitis, the most well-tolerated group of antibiotics. Now, it turns out 20, 30 years ago, we learned that these antibiotics increase the risk of rupturing an Achilles tendon. That's a structure made of collagen. We learned in the last 5 years they increase the risk of your aorta getting enlarged or even rupturing, which can be fatal. That's a structure made of collagen. Heart valves are made of collagen. And there is now this really, really advanced and scary science. These antibiotics cause an enzyme to start chewing up your collagen the days you're taking the little pill and the few days after. So that 30 days is risky. Now, overall, it's still only 1 or 2% of people. But when you're talking about millions of doses, 30 million doses a year, we have reason to be concerned. And the FDA is suddenly all over this. The former director of the FDA, a cardiologist, Rob Califf, said there should be immediately a substantial reduction in the use of this class. Questions if we can't use penicillins or other antibiotic classes like
It's
sulfa.
one of those drugs that has a black box label.
It already has a warning for the
So I
tendon
mean,
issues,
that's
sure.
as serious a warning that they put on a medication that's routinely prescribed.
Correct.
I mean,
so I think, again, what this comes down to is you have to have a relationship of trust with your doctor. And if they've done a culture and they tell you that a fluoroquinolone ending in fluoxetine is the best choice for what you specifically have, sometimes for certain gram-negative infections, there is no other oral choice. So you're looking at either going on a fluoroquinolone or being admitted to a hospital and going on an IV antibiotic. Then I think you always have to weigh the risks and the benefits. And like you said, the risk is 1 to 2%. It does have a black box warning, but be aware that this risk exists. If you start taking these antibiotics and you develop chest pain or you develop ankle pain or you're developing symptoms, and you have to stop taking it and let your doctor know right away.
That's the caveat, that if you really have to have it, and I agree with you that there may be indications where this is the best drug, but really listen to your body, because as Dr. Kahn said, if you feel it starting, boom, stop, nip it in the bud then, because you potentially can stop that process of breaking down structures where collagen is so important.
And I believe the data is that it's more likely the older you are. So these risks escalate as you age.
Don't rub it in.
But one more example, if I may. One more example of the more we can minimize the unnecessary use of these procedures and these pills, these antibiotics, the better. But to your point, sometimes they are necessary.
The one good news about this bad story is if you're past 60 days and you got your antibiotic in the past, the risk essentially disappears. So a lot of people watching and listening took an antibiotic like this 6 months ago. You're past the window of risk. It's amazing how it's really the acute exposure to the antibiotic.
Dr. Kahn, appreciate your input.
Thank you.
Thank you.